Now, today we'll be comparing very interesting two drugs. One is the furosemide or LASIX, which we very commonly know, and the second one is spironolactone. Now, LASIX is a strong diuretic. What does it mean by is it can create huge amount of urine output, and the effect of the LASIX totally depend on the dosage of the medicine that we are giving. If we are giving 10 milligram LASIX, it can create maybe 100 ml output every hour. If we increase it to 20, 30, 40, 50, 60, 70, and then more and more urine output can be produced. So with higher and higher dose, furosemide can produce up to 10 liters of urine output also per day. So there is more is the dosage, more will be the diuretic effect. Though, but this is not seen with spironolactone. Spironolactone won't give much urine output, so it is not a strong diuretic. It is one of the adjuvant drug along with the Lasix or along with the furosemide. So it will not create huge diuresis. This is one of the main difference. So this furosemide has a weaker antihypertensive property than thiazide. So this can create huge urine output. It can markedly drop the blood pressure, but overall, this is not a drug which is very commonly used to control the hypertension. So if a patient is presenting with 150, 160, 170 millimeters of mercury blood pressure, then this is not the drug that we start to control the blood pressure. So this is the drug which we very commonly start for controlling the edema, controlling the shortness of breath, but this is not considered as a first line antihypertensive drug. So, but this can cause huge diuresis. So the patient can have a rapid fall of blood pressure. So this medicine can cause hypotension in very short period of time also. But the spironolactone, on the other hand, it reduces the blood pressure very slightly. It won't cause marked blood pressure fall. So it may cause blood pressure fall of around 6 to 10 millimeters of mercury, and that can be better when it is used with other drugs as well. So this furosemide or Lasix cause significant blood pressure fall, and the effect totally depends on the plasma volume, reduction in the plasma volume, and reduction in the cardiac output. Because the patient has diuresis, so there will be reduction, there will be increased amount of urine that is produced, more fluid or more water will be flushed out of the body because of the diuresis. So automatically the blood pressure fall will totally depend on the reduction in the uh, fluid volume or water volume of the blood. The duration of action of this Lasix furosemide is around 4 to 6 hours. That is the reason why it is called La6. The 6 stand for the duration of action. It is around 6 hours. That is the reason why we very commonly use this drug around 3 times a day, 2 to 3 times a day, depending on our effect. This drug, this Lasix, as we say, it will cause diuresis, but it will not reduce the peripheral vascular resistance, or it will not cause any vasodilation, which is the effect of calcium channel blocker. So, this Lasix won't cause total peripheral resistance reduction, or it will not hamper the vascular responsiveness when compared to calcium channel blocker. And as I said, it causes marked volume reduction, it causes marked diuresis, fluid imbalance can be definitely a problem. Whereas with spironolactone, as it is one of the potassium sparing drug, it can commonly cause hyperkalemia. This is a very common problem. In fact, if the patient has persistently low potassium level, if the patient has persistent hypokalemia, and if the patient is on Lasix, this spironolactone is added to prevent the potassium loss. So, if the patient has borderline creatinine or borderline renal dysfunction, then these patients, if the patients are on spironolactone, can very commonly have increased risk of hyperkalemia. So, for time to time, those patients are on spironolactone must be very carefully monitored for serum potassium. Whereas with Lasix, very commonly the patients have hyponatremia and very commonly also have hypokalemia. So here the potassium is low, here the potassium is very commonly high. So this is what I told. Ki the patient very commonly has hyponatremia and hypokalemia is very common, but here hyperkalemia is very, very, very common. So this Lasix, it is the one of the best drug for acute LVF in acute left ventricular failure, where the patient is pretty dyspneic, where the patient has hypoxemia, where patient is tachypneic, where the patient's respiratory rate can be 30, 34, 40. There, if you start furosemide, there is immediate reduction in preload as well as afterload. There is reduction in the blood volume by reduction of the fluid or water volume from the blood. So the pressure which the left ventricular faces markedly reduces, and the patients feel very, very comfortable even within 30 minutes of giving the Lasix. Whereas this spironolactone doesn't have this marked reduction of fluid volume. So this is not a drug for LVF. So whenever there is acute left ventricular failure, fluid overload, volume overload, or those patients who have renal failure, chronic renal failure, because in acute renal failure, no furosemide, no spironolactone, no drug will help. If the patient has acute renal failure, if the patient has urine output of less than 100, then only dialysis will help, otherwise no drug will help. So, congestive heart failure, chronic renal failure, those patients who are breathless with fluid or volume overload, Lasix is one of the best drug because that reduces the shortness of breath very, very, very well. And this furosemide is given around 2 to 3 times a day, very commonly 4 times a day also, depending on response, depending on the dosage. So, as this drug causes marked fluid loss, marked reduction in a marked increase in urine output, there can be a significant problem with postural hypotension. But this spironolactone at it doesn't cause any marked diuresis. There is no postural hypotension with spironolactone. And as I told, this furosemide is not a good drug, is not a first line drug to be used continuously over a period of months, years for hypertension. Because those patients who have hypertension, they are the best drug for the hypertension are this angiotensin receptor blockers like telmisartan, olmesartan, calcium channel blocker like amlodipine, cilnidipine. These are very good first line drugs because they won't cause this electrolyte imbalance, postural hypotension, hypokalemia, hyponatremia. So those drugs are considered first line antihypertensive drugs, but this Lasix is not considered as a first line drug. Whereas with this aldactone, this spironolactone, it is the drug that augments the action of other antihypertensive agents. And with this drug, this gynecomastia is very common problem. Impotence is very common problem. So this gynecomastia is very usually painful when it comes to spironolactone. And whenever the patient has gynecomastia and then the patient is on spironolactone, we tend to switch this spironolactone to eplerenone if it is needed or amlodipine if it is needed. As I already told that it augments or potentiates the antihypertensive effect of other drugs like Lasix, torsemide or telmisartan or beta blockers. The best part of this spironolactone is it has inhibitory activity on renin-angiotensin aldosterone system, which this Lasix doesn't have. So it actually prevents the left ventricular hypertrophy. In fact, it can reverse the ventricular hypertrophy, LVH. It can reverse or prevent the vascular hypertrophy. It can prevent or reverse the renal fibrosis. It can prevent or reverse the cardiac remodeling in some portion. That is the reason why it has a cardioprotective role. It has a ventricular hypertrophy protective role. It has a vascular hypertrophy protective role. So this medicine is one of the most important pillar for heart failure. So any patient who has ejection fraction of less than 40, this is one of the must drug to put on because it prevents the ventricular hypertrophy, prevents the vascular hypertrophy, prevents the renal fibrosis, prevents the cardiac remodeling. But all these effects are not seen with furosemide or Lasix. So the one of the important use of this spironolactone is if the patient has refractory hypertension, if the patient is already on, suppose, max dose of this angiotensin receptor blocker or calcium receptor blockers, LASIX or torsemide, and even after that, if the blood pressure is not getting control, then we very commonly consider spironolactone because it potentiates or augments the antihypertensive effect of other drugs. So as I told earlier also, patients can have hyperkalemia and they can die suddenly. So monitoring of potassium is very necessary whenever the patient is coming to the OPD for follow-up. Very commonly, the drug dosage which is used is 25 milligram to 100 milligram per day, and it is definitely not a first-line antihypertensive drug, but it can be used in a very low dose to augment the effect of furosemide or torsemide or other antihypertensive drug, so that the drug dosage of other drugs gets reduced automatically. So this was about the comparison between the LASIX and spironolactone, and we'll be coming again with other topics as well. And thank you.